Hello, I'm Ian Watson and this is Lorna, and I'm going to show you how I would examine the hip and the groin. Before we go straight to the hip and the groin, there's two or three things that I would want to do first. The first is have a look at footwear and ensure that there's no abnormal wear and tear. I'll also be having a look at Lorna's gait and watching her walk. I'll also then be looking at her spine, looking at her core stability, and also a basic spinal examination just to ensure that there's no pain being referred to her hip from her spine. So looking at her footwear first of all, I'm ensuring that there's no abnormal wear on the sole that I would be surprised to find. And that all appears to be normal. And then I'm just going to ask Lorna just to walk down there for me, and I shall watch, ensuring that she's got no pain and that her gait appears to be normal. That's great, thank you very much. Whilst I have Lorna stood up, and for the purposes of this I'm going to leave Lorna's top on, but obviously in a patient examination I would be wanting to expose completely to skin. What I would want to do is ensure that her iliac crests were level on both sides and there was no unevenness. I will want to have a look at her spine, so what I would do is ask her just to turn sideways on. I want to make sure that we have the normal lordosis, the normal kyphosis, and the lordosis further down as we move down. Assessing her core, what I would ask Lorna to do is if she could just stand on one leg for me, please. And then if you just stand on the other leg. What I'm looking for there is ensuring that there's no abnormal wobble and she seems to be strong. And we can progress that by asking her to do a single leg squat. So if you stand on one leg and gently squat down and hold it for a second and then come back up. And then if you just do that on the other side and down and come up, that's great. So I'm happy there, the core seems to be strong. The final test while I've got her stood up is called the stalk test, and this can cause pain with either sacroiliac joint abnormalities or spondylolysis. And in order to do that, what I'm going to ask Lorna to do is to stand on one leg and then gently lean backwards. That's wonderful. And then if you just stand on the other leg and gently lean backwards, that's fine. Thank you very much. Now I'm going to ask Lorna if she just sits on the other side of the couch around there. Sitting down will fix her pelvis. And what I'm going to do while she's sat down then is just have a look at what her pelvic movements are like. I'm going to gently just feel down her spine initially and make sure that there's no bony tenderness. I'll feel in the muscle bulk around her lumbar region to ensure there's no wasting. I'll feel along her iliac crests, make sure that there's no tenderness there, and I'll also just gently palpate her sacroiliac joints, and again ensuring that there's no tenderness there. I'll then just assess the range of movement of her spine, so I'll ask her to lean forward as far as she can, so if you roll up into a ball. And again, I would be looking for ensuring that her spine is aligned nicely. And if we just do the opposite and you lean backwards, ensuring that she's got extension that's pain-free. If you bend to the side, and then to the other side, and then if we just rotate one way and then the other, and then the other, again ensuring good range of pain-free movement there. Right, if we could lie you down there. Progressing just a little while longer on with the spinal examination, what I'm then going to want to do is just a very brief neurological examination. So in order to do that, if I ask Lorna to pull her toes up, push your feet down, that's wonderful. Can you lift this leg up as high as it will go? And then down, so this is a straight leg raise, and the same on the other side. That's wonderful, thank you. I'm then just going to check sensation and ensure that that's normal. No difference on either side, it feels the same?
Same.
Okay, that's great, thank you very much. So from a spinal perspective, I'm happy that Lorna has a good range of movement, there's no pain, and therefore any hip pain that she may get, I don't think it's going to be becoming radiated from there. So focusing on her hips and her groin now, what I then want to do, I've inspected already and I've watched her walk, is to palpate. So palpating her anterior superior iliac spines, this is where sartorius arises from, ensuring that that's not tender.
That's fine.
looking at her, making sure I'm not causing any pain, and lower down the anterior inferior iliac spine, which is where rectus femoris arises. I want to feel the pubic rami. Stress fractures there can be tender, and also the symphysis pubis with osteitis pubis, you may expect to find some tenderness there. That's good. I just want to now palpate the adductors and the gracilis. So what I'm going to do is ask you just to bend your knee for me and let that just move out. And then I'm going to palpate along there and ensure that, that there's no tenderness there. That's fine. And I would do the same on the other side. Palpate a greater trochanter.
That's fine.
Make sure there's no tenderness. And again, just up to the iliac crest and make sure that there's no tenderness radiating up there. That's fine. Can I just get you lined on your side, please? With Lorna on her side, I can palpate the hamstrings on both sides and ensure there's no tenderness. I can palpate piriformis and the sciatic notch and ensure that there's no tenderness around there. And a little lower down, the ischial tuberosities, where the hamstrings arise, and ensure that there's no tenderness there. Another test I can do for the sacroiliac joint whilst Lorna is in this position is called the lateral compression test, where I will push down and make sure that that doesn't cause any discomfort. Is that okay?
Yes, fine.
Okay. That's fine. So if we just get you rolled over onto your back again, thank you. So palpation, I'm happy with that. Now we want to look at range of movement. And what we're going to do there is flexion, abduction, adduction, internal and external rotation, and then move over onto her front test extension. So thinking of flexion, first of all, the hip flexes due to a couple of reasons, couple of things. One is the quad muscles, and then the other is the iliopsoas. With your legs straight, if you lift this leg up, all the way up, that's brilliant, thank you, and then pop it down, and then lift up again, that's down, that's good. And whilst we're doing this, I can also test for the power, so if you just lift up again, keep it there, I'm going to push down, that's good, and if you lift up again, keep it there, push down, that's good. Now if I ask you just to bend your knees, and the other knee, and if you pull your knees up to your chest as far as you can, that's good. Now this tests iliopsoas, and I'm just going to add a bit more on there just to make sure that that's still pain free, and then just move down there and ask you to pull up again if we test for the power. That's good, that's fine. Whilst I'm thinking about iliopsoas, a test that we can do to ensure that there's no contracture or flexion contracture in iliopsoas is called the Thomas test. And in order to do that, what I'm going to ask you to do is if you pull your knees back up to your chest for me, and then pull that tight towards you, and if you let go of one leg, hold your hand onto this leg, that's great, and then if you let that go flat, that's great. So that goes flat very, very nicely. With a flexion contracture, I'd expect that not to flatten. And if we just repeat it with the other side, so pull both up, hold this one, and let that go flat, that's great, that's wonderful, thank you. So that was Thomas's test. Testing abduction and adduction, if I just ask you just to put your legs flat again for me, thank you. Abduction, if you just move your leg out. And again, I will add some more just to that to make sure that that's okay. And just move you back that way, and I'm going to push, and I want you to stop me. That's good. And if you just do the same on the other side, and then pull it in a little, and then stop me pushing, that's good, thank you. For adduction, if I just ask you just to cross one leg over the other as far as it will go, and then put it back to normal, and then do the other side, that's good, thank you. And to test the strength of that, and ensure that it's pain-free, is the squeeze test. So if I just put my fist between your knees and ask you to squeeze tight, that's good, thank you very much. External and internal rotation next. So in order to test for that, what I'm going to do is I'm just going to ask Lorna to bend her knee, And then if you just let that flop out as far as you can, that's fine. And I'm just going to add some more to that and ensure that that's pain-free. Now, what you may notice is that as the hip externally rotates, the ankle actually internally rotates. So in order to test power of that, what I will be doing is pushing on the medial side of Lorna's ankle. So if you stop me pushing, that's good, thank you. Internal rotation has the opposite movement, so we go in, and again the test for that power of that is you stop me pushing. That's good, thank you. And again, what I'd be wanting to do is to be repeating that on the other side. Another quick test that I can do just to assess the hip joint itself is called the log roll test. So this is moving the femoral head in the acetabulum and ensuring that that's pain-free and not causing any pain. And that's okay. Good. Whilst Lorna's on her back, I can assess the hamstrings to ensure that there's no tightness there. So if I just get you just to bend your knee and let this flop, and you relax, and what I'm going to do is just straighten your leg. So in doing this, I'll probably expect extension to around about 140 degrees, which we've got. That's fine, good. Now, if I just get you just to roll over onto your front. Wonderful, thank you. So what I'm going to be looking for now, I'm going to do a couple of things, trying to minimise rolling over and moving backwards and forwards. So just going back to range of motion and internal and external rotation, we can also look at that with somebody on their front. So if I just bend your knees, or if you bend your knees, thank you, we can look at external rotation and we can compare what both sides look like for this. So just by letting your legs go out, that's wonderful, that's good. So that looks to be the same on both sides. And then I'm just going to cross over and just assess internal rotation on both sides that way. And again, that seems to be okay. Now, when we were flexing, we had two different muscles that could flex the hip, and likewise, two different muscles are able to extend the hip as well. And that's going to be the hamstrings and all the quads. So to test the hamstrings, what I'm going to ask the woman to do is to keep her leg straight. And if you just lift this leg for me, thank you. And can you keep it there? That's great, thank you. And if you just do the same to the other side and keep it there, wonderful, thank you. To assess quads, we want to take the hamstrings out of the equation. So what I'm going to do is just ask you to bend your knee, and this time just lift that again for me, and then keep it there. Thank you. Sorry, I said quads, I meant glutes. And if we just test the glutes on this side, if you bend and straighten, lift it up, and keep it there. That's great, thank you very much. I'm just going to ask you now just to turn back onto your back, please. Thank you, Lorna. So, we checked range of movement and we've also checked for power. Another muscle that we can check actually that is sartorius. Sartorius brings the heel up and down the shin. So I'm going to ask Lorna just to finally just do that. So if you just run your heel up and down your shin. That's great, thank you. And then the other side. That's great, thank you. So now I'm going to move on to some special tests. What I'm going to do there is sacroiliac joint, piriformis, what to look for with a snapping hip, and also when one might suspect a stress fracture. Sacroiliac joint, we've already shown the stalk test, and we've already done the lateral compression test, but another test for that is called the Faber test, which is flexion, abduction, and external rotation. And in order to do that, I have to stabilise the pelvis, because otherwise the tendency will be for Lorna's pelvis to lift off. So what we're going to do for that is, when I bend your knee, I'm going to hold down. I want you just to let this leg flop. And then I'm just going to add some extra to that, and make sure that that's pain-free. And likewise, we'll do the same on the other side, and then just let that flop. And ensure again that that's pain-free. Piriformis we've palpated before, we've tested it to a degree, actually also with resisted external rotation. But another test for piriformis is going to be to ask Lorna just to bend her knee and then pass the knee over here. And this stresses piriformis and make sure that that's pain-free. And again, we'll just do the same on the other side. And make sure that's pain-free. Yeah?
Yeah.
The stress fracture, one can try percussing. And what one would do would be, if this say was the suspect leg, what we would do straight is percuss the heel, and then bend the knee, percuss there, and make sure that all of this is pain-free, and finally percuss over the greater trochanter and ensure that that's pain-free. Finally, a snapping hip. Now that may be due to one of three reasons. It may be due to some snapping of iliopsoas, it may be some snapping laterally over the greater trochanter, or it may be due to a labral tear or a loose body within the joint itself. To test iliopsoas, what I would want to do is to palpate over that area and keep my hand there, and then ask Lorna just to bend her knee, and we'll externally rotate, and then I'm going to ask her just to straighten it while she internally rotates it. So if you could just do that for me and straighten it, and I'll be feeling for any popping feeling and asking, is there a snapping feeling while she's doing that? Again, if it was the other side, I would be doing the other side as well. If we're thinking about lateral snapping, what I'll do is ask Lorna just to lie on her side. And again, I'm just going to put my hand over her greater trochanter. I'm going to extend her leg and then internally and externally rotate and make sure that I can't feel any snapping or she can't get the sensation of snapping. And an extension of this is going to be the over test, which is to extend, and then just ask Lorna just to drop her knee. And she should be able to get it down to the level of the other knee. If she can't, excuse me, then she may have a tight iliotibial band that's causing that. Whilst I have her on her side, and if I'm thinking about a labral tear or a loose body, I can test for that initially posteriorly by taking hold of her lower leg and clasping it here, because I need a free hand in order to be able to put that over the posterior part of the joint. And then what I want to do is to go to the extreme really of ensuring internal and external rotation, and that I'm not able to feel a pop within that joint. Okay? Is that okay?
Yes.
Okay. If you just lie on your back for me again. Thank you. I would want to do the same anteriorly. Just before I do that, and I did this before, a log roll may cause some discomfort with this as well, as we did before. And what I'm going to do now is much the same as I did, but locking the lower limb under there, putting my hand over the anterior joint, and then externally and internally rotating and making sure that I can't feel any popping. Okay, that's great. Thank you very much for that. And that concludes my hip and groin examination. Thank you for watching.